occupational therapist will take a referral from the patients at the ward, and they would initially screen them and make sure that they're safe when they go home, because that's our main priority. We want to make sure they're safe when they're home and make them as independent as possible. So if the patient's having difficulty with washing and dressing independently, then the OTA may go in and practice that for the time that they're at the hospital, so like maybe 3 times, 4 times, depending on how many times the OT asks. Other things that we may do would be to do kitchen assessments, so practice with making a cup of tea or making a light meal or snack, so we'll do that as well. One thing that I find, especially in elderly care, we want to make sure they're safe when they go home and they'll be able to manage with these things. If we practice washing and dressing with patient, we always have to document our notes as well. So there's 2 different types of notes. There's OT notes and medical notes. Usually the medical notes are just what the medical team needs to know, so they don't necessarily need to know exactly what we did at the washing and dressing assessment. So you would document just the OT notes, so therefore if the OT wasn't there that day, they can always see what was said. And it's obviously really important to document your notes for legal reasons as well. So a lot of the day, or many days, you end up going to home visits or access visits. Home visits are when you take the patient that's on the ward with you, with the OT, and you just check out, basically see what they're like in their home environment, so how they're managing in their home environment. So if you do a kitchen assessment here, it's not really going to be the same as when they're home. So often patients are better in their home environment because they know where everything is, so sometimes the OT will decide, look, we need to see them in their home environment. So we take them on a home visit and just check how they're managing with all their transfers, getting on and off their beds, managing with a cup of tea in the kitchen, getting on and off the toilet, those sorts of things.
Okay.
And then sometimes, though, we'll do access visits. So if we don't think it's necessary for the patient to actually come to the visit with us, the OTA can then go and do access visits on their own. And basically you're looking at their home environment again and taking measurements of doorways and measurements of furniture height, so that the patient's transfers are safe when they get on. Sometimes we'll have to raise chairs or beds to make it easier for patients to get on and off. And usually we'll know that by what they're doing on the ward. So if they're getting on and off the chair at 19 inches here, then we might say, ooh, their chair's only 15 at home, so we have to try and we'll put some equipment in to raise it or get them a new chair.
Okay.
So,
Rolling
yes,
again. Okay, so what kind of person do you think is going to be successful as an OTA?
You definitely have to be a people person and want to work with people on a daily basis. You work so closely with them and you look at all different aspects of them, so social, emotional, medical. You get really close to the person physically as well when you're doing transfers with them or bathing assessments with them. So if you're not someone who wants to get close to people or comfortable to get close to people, then it's not probably the job for you.